The World Health Organization says the highly transmissible Omicron subvariant BA.2 is continuing to fuel a rise in cases in 18 European countries. The WHO reported nearly 3 million new infections so far this week in Europe alone, and they are linking those spiking cases to COVID-19 restrictions being lifted too quickly. For more, I'd like to bring in former CDC Director Tom Frieden. He's also the former health commissioner for New York City and current president and CEO of Resolve to Save Lives. Dr. Frieden, thank you for joining us here. What are the rising cases in Europe telling us about this new variant?
There are really three things going on, Chris. First, this variant is stunningly infectious. The Omicron variant itself was incredibly infectious, and this is even more infectious. Second, masks are coming down, restrictions are dropping. And third, our immunity is waning. What this means fundamentally is that it is likely that we will see some increase in the US, but that doesn't have to send us back into our homes. The key things are to adapt as the virus adapts, to vaccinate, including staying up to date, and to mask up when appropriate.
But Dr. Frieden, we're at a point where COVID restrictions are going away across the United States. Americans are tired of wearing masks. You're hearing just this week, the airlines want the mask mandate on planes to drop. Are you saying that that all needs to be walked back?
No, I don't think so. The most important thing we can do is get people vaccinated, especially seniors. There are at least 15 million people over the age of 65 in this country who are not up to date with their vaccinations. And if you're one of those people, I'm sorry, but Omicron BA.2 variant may be coming for you. It's a hard thing to say, but look at what happened in Hong Kong. This is a population where very few seniors were fully vaccinated and few people had had infection before. Devastating death rates there. So even though Omicron is less severe than earlier variants, it's still ferocious in someone who isn't up to date with their vaccinations.
So what would you say the most important lessons that we've already learned in fighting the coronavirus do we need to apply for what may be coming?
Well, first, the virus is adapting. That's what viruses do, and we need to adapt also. We need to adapt as it changes. We need to change. That means, yes, we do need a third and possibly even for some people a fourth dose. So stay up to date, get up to date, and stay up to date with your vaccinations. Second, masks are a more complicated issue. If you are immunosuppressed, if you're older, if you're in a crowded space, especially if people around you aren't wearing masks, you probably want to up your mask game and use an N95 mask. We need to get more like what the culture is in East Asia. If you're sick, if you're exposed, if you're immunosuppressed, if you're worried, if your nose is cold, wear a mask. No harm, might save your life or somebody else's life. But that doesn't mean we need to shut down again. By vaccinating, masking up, testing, and treating, we can get through this and control COVID instead of allowing COVID to control us.
Dr. Tom Frieden, thank you, sir. You're CEO of Resolve to Save Lives. Thanks for your time here today as we get ready for the pandemic that won't quit.
Thank you.